So that's the story.
Good. Well, that was a good presentation, Roshi. So, what do you think's going on here?
I'm pretty sure it's pericarditis.
Okay, pericarditis. So, why in this 40-year-old with ST elevation and chest pain are you sure it's pericarditis and not an acute myocardial infarction?
Well, the presentation, the history, she said that it gets worse with deep breath and laying back. And, she's only 40 and doesn't have a lot of risk factors. So I think that leans more towards pericarditis.
Okay. Good. Well, I think one thing to think about when you have a patient like this with chest pain is just as you described, is thinking about the nature of the chest pain, because this is one of the differentials you have to make. So, is the pain consistent with myocardial ischemia, where it's pressing in nature, made worse by exertion, or is it pleuritic, like you described, so it's worse with positions or with deep breathing or coughing? And that kind of pain is certainly more consistent with pericarditis. So I think that was certainly a good pickup on your part. That's correct here. However, thinking about it in one sense, just being 40 years old without a lot of risk factors in the right scenario isn't 100% reassuring. That this couldn't be a STEMI. But I think if we put her whole picture together with her recent viral illness, like you described earlier, and what her EKG looked like when we looked at it, I agree that this is probably all pericarditis. So I think keeping in mind kind of how to differentiate the kinds of chest pain is really, really good and something to kind of take away from this.